Welcome back to The Wellness Effect. Subscribe to our channel and hit that notification button so you don't miss out on any of our discussions with our experts. Mzamo Mbuli, a clinical psychologist, joins me to discuss mental health, specifically in light of the cultural perspectives and possible stigma. Welcome, Mzamo.
Sure. Thanks, Seth. Thanks for having me.
It's an absolute pleasure. Before we get into our discussion, could you define for us mental health versus mental illness?
So it's a pet peeve of mine because fellow professionals also mix up the terms mental health versus mental illness. So when we speak about mental illness, it's talking about the conditions. We speak about how a person thinks, how a person behaves, your emotions, and how that causes mental illness. So that would affect your functioning, either socially or in the workplace. That's mental illness. There's almost 300 types of different mental illnesses.
Wow.
That's what we're talking about when we speak about mental illness. But when we speak about mental health, we're speaking about someone who's able to cope with everyday normal stress.
Sure.
Someone who's able to make like a positive contribution to their community. We're speaking about someone who's living well. So what we're trying to emphasize, especially with people with mental illness, that yes, you can have mental illness, but it's also possible to have mental health. And just because you don't have a mental illness doesn't necessarily mean that you have mental health. So I think those, if we think of it like that, I think it's more helpful.
So how do different cultures define and understand mental illness?
So we live in South Africa, different race groups, different ethnicities, different tribes, and so forth. I think there's a common understanding about mental illness. But whether or not people accept it, that's different in the different ethnicities and cultures and races. Also, the causality of mental illness. So if you're coming from a Western perspective, it's a mental illness that can be treated with Western medicine. But if you're coming from a more traditional African, maybe spiritual perspective, yes, it's mental illness, but the causality is different. It might be that utakatiwe, i.e. you've been bewitched. It might be that you have a calling that you're not listening to, hence you behaving or thinking in a strange way. It might be even from their perspective a natural cause. So yes, there's an understanding of what mental illness is, but the causality and the treatment is different. Just to give you some stats, 70 to 80% of South Africans go through traditional healers for psychological, psychiatric ailments.
Interesting.
Even before they come to us, your psychologist, your psychiatrist. So that tells you people's belief informs the treatment. Yes, we accept that there's mental illness, but we don't necessarily maybe agree with the causality of what's causing the mental illness. And I like your question because I think the different ethnic groups, we all have the same problem. We all deal with stigma and all of that, but depending on the ethnic group or cultural group, I think that the intensity of the mental illness is different. So if you come from a very, let's say, rigid, very structured family background or culture where the roles are defined, a man must do this, a child must do this, that's a very rigid, where you don't really individuate or differentiate. And if you don't follow those social, cultural norms, it's easier for mental illness to manifest. So for example, if you come from a Jewish culture, that's very rigid. If you come from maybe Zulu, Xhosa, where tradition, roles are important, mental illness will present itself a bit differently as opposed to a different background that's not so rigid and so forth.
So you mentioned something interesting that 70 to 80% of South Africans who experience mental illness go to a traditional healer. And then when they come to you, how do you then support them post that?
Sure. So clients will test you, like do you believe in what I believe in? That's why it's important to us as therapists to be culturally adverse, or to at least understand people's cultures. Whether like it's white people, but there's different types of white people. You get Lebanese people, you get Jewish people, you get Portuguese people, And these nuances that you need to understand. Yes, you get African people, but it's different beliefs and traditions, and you need to acquaint yourselves with those cultures and beliefs. In fact, if you look at our diagnostic manual, that's what we use to diagnose. We can't really diagnose if we can only say it's a disorder or an illness if it's an abnormality in that culture. So we need to be acquainted with people's backgrounds and cultures and so forth, and able to assist. Especially if you of a different race, different ethnicity from the person. The client wants to be obviously open, but they need to be open knowing that, okay, but this person understands my background. This person understands where I'm coming from. This person understands my beliefs and my customs and so forth.
I like that you mentioned it's really around understanding, respecting and acknowledging, and then they can receive the treatment options that you offer.
Yeah, because think of it. If you think, yes, this person's here to help me, but they don't understand me, I think 70%, 80% of therapy is a relationship between the therapist and the client. The techniques and what we use, the medication, that's secondary. But if I create a safe space, if I trust Seth, if I trust Mzamo, then healing can take place. Then therapy can take place. At the end of the day, yes, we come from different backgrounds, but if I'm able to connect to another human being, that's when healing can happen.
And post-COVID, did you see a rapid rise in mental illness issues perpetuating our society?
I think especially with younger people, I think younger people, they have the knowledge. If you look at social media, it's out there. But I don't think they necessarily understand. So you might have the knowledge, like we say to clients, like we're speaking about different families, so different cultures. So some cultures, yes, accept that they acknowledge that there's a mental illness, but don't necessarily accept. Yeah, those are two different things. I might know something, but doesn't mean I necessarily believe in that. I think that's where people are coming from. So with young people, sure, a lot of young people come, hey, they'll even tell you, I've got depression. I'm like, oh, okay. So tell me about this depression, because maybe I Googled this and I saw this. Or I think even with our younger kids, like our teenagers and our children, hey, I'm neurodivergent. You know, it's like almost a fad for some people. But if you've really got the illness, it's serious. So the knowledge is out there, but it's guys like yourself that help with psychoeducating people about, okay, yes, this is what it is, but this is what it really means. That's really helpful for people.
And what are kind of the treatment options available for those?
So even before you get to a psychologist necessarily, you probably speak to a GP. If not a GP, you probably speak to a social worker. That's where we get most of our referrals. So people come with like social issues, but the social worker or the GP will see like, okay, this is actually like a psychological problem. And then you'll probably see a psychologist. It can be a clinical psychologist. It can be a counseling psychologist. If it's a child with school issues, it can be an educational psychologist. If maybe it's more of a performance from a workplace, it might be an industrial psychologist and so forth. And then clinical psychologists like myself, where we primarily see like severe pathology or all types of pathology. And then if I can't help you, I see that maybe you need extra help, then I would refer you to another specialist, which is a psychiatrist. Psychiatrist, obviously trained to give you medication. They also have that medical background to rule out maybe how you're thinking and how you're behaving. Maybe let's rule out medical issues. So, for example, if you go to hospital, they'll do an LP on you. For people who've experienced that, very painful, where they do a lumbar puncture on your back to see if there's any effect maybe on your brain. Maybe that's why you're thinking the way that you're thinking, to rule out any medical causes for your thought process, your emotions, and your behavior. And then obviously a psychiatrist will guide you in that process in terms of the type of medication that we'll see. Most of the time, from my perspective, because we work in a multidisciplinary team, You'll be seeing the psychiatrist who will also assist you with the meds. Then you'll be seeing myself as the psychologist, and sometimes with family issues and so forth, maybe even a social worker at the same time to resolve those psychological, those psychiatric issues.
Speaking about work, how does toxic work culture, stress at work have an impact on mental health issues?
I can't tell you from the top of my head, but I think stats say we spend 70% of our lifetime at work. So if you're spending 70% of your time at work, and if it's toxic, you are going to face those challenges. I recommend a very good book for people who are struggling with that. It's called Surrounded by Idiots. Interesting title, but I think it's very helpful. I usually recommend that to my clients who are struggling at work, because work is like, if you think about it, preschool, right?
Yes.
Maybe I'm struggling with other kids. There might be a bully. I can't deal with this bully. How do I deal with this bully? So if you don't master those life stages, like at preschool, or if your parents always intervened when you had a problem,
Sure.
then you get to a work environment where there isn't a mommy and daddy.
Correct.
And how do I deal with abuse? How do I deal with gaslighting? If you don't have that experience, then you'll struggle. So it's important for us as parents to allow our children to master things, guide them, yes, but we shouldn't be doing things for them, because then you will struggle in the workplace.
Correct.
You will struggle in the workplace.
And maybe as we close off the discussion, how do we deal with the stigma that perpetuates mental health and mental illness issues that sometimes keeps people away from seeking support?
Hey, Seth, that's a hard one. I'm going to give a hard answer, and that is self-stigma. That ultimately, if you, like we spoke about, mental illness, mental health, if you're a person, even you don't have a mental illness, you believe maybe, for example, that you're always right, that you don't have a problem. The day that you have a mental illness, you're not going to accept that you have a mental illness because of how you're wired. So I think it's more the self-stigma. If someone has cancer or serious medical condition, people empathize and all of that. But with mental illness, it's different, because people blame themselves for having the mental illness, which isn't always correct. It's actually the wrong way to view it. And because I have a mental illness, that means I'm crazy. That's just one categorization of, we spoke about the different categories. There's other different types of mental illnesses. So people think if I go to a psychologist, psychiatrist, it means I'm crazy. Not necessarily. You might just have depression. You might just have post-traumatic stress because maybe you were involved in some crime. You just need to reflect. So education, like we're having the show today, I think that helps. But over and above that, self-stigma. Know yourself, know your strengths, know your weaknesses, and get over yourself.
So we live in this highly socialized world where, we have friends, we have family members, but when do you draw the line to figure out, this issue can't be dealt with my peers or my best friend or my family member, but this has to be with someone who's quite professional and experienced, like someone like yourself?
I can tell you, Seth, what clients tell ourselves and people like myself, they don't tell their friends. Because we might have support in terms of family and friends, but we aren't always. You must remember that a friend, a family member, they're biased. In other words, I can always have Seth's back, which means sometimes I'm afraid to give him negative feedback. Your therapist isn't like that. Us as therapists, it's not necessarily to give you negative feedback or positive feedback, but to give you a different perspective. You know what you're going to get from your friends. They'll always support you, always love you. It's not the same with your psychiatrist or your therapist. And I suppose also with our friends and families, people also go through things, and maybe you want to open and share, but that person is not in that space because of their own issues. That's why somebody would say, like, look, bro, like, actually, I don't want to hear that. Go speak to someone about that because of their own issues and so forth. You see that it's a lot, especially with couples, married couples. My frustration would be, yes, we're going through the family sessions or the couple sessions, and the only time that they talk about difficult things is when they're in the therapy room, which is not great. Because what we do in the therapy room as a couple, you want the couple to do the same thing in the real world, outside of the therapy room. We don't want people to be dependent on therapy, which happens with some people. But yeah, that's another conversation.
What are tools to keep my mental health up? Like what should I be doing? Is it exercise? Is it sleep? Is it nutrition? Yeah, what are the foundational things that contribute to an optimum mental health space?
It's again, Seth, one of my pet peeves, because the concept of mental illness inadvertently makes a distinction between mental illness and physical health and spiritual health. The three are interconnected.
Okay.
If you're not mentally well, physically you won't be well. Spiritually you won't be well. So what you want is alignment. What you want is harmony. Because if you're physically well, that helps with your mental illness. In fact, a psychiatrist will tell you if you exercise, even if it's 3 times a week, it produces the same effects as maybe an antidepressant, increasing your feel-good hormones and so forth. So the three are interconnected. If you just have if you've been diagnosed with a serious medical condition, you can't separate it from your mental health or your mental illness. Because if you have a positive mindset, hey, I am going to get better and I have support, that will help you in terms of healing physically. So the three are interconnected.
Excellent. Thank you for this fascinating but also insightful discussion.
Oh, thank you guys for having me.
It's an absolute pleasure.
Sure.
Subscribe to the Wellness Effect YouTube channel for more discussions like this and so much more. Till next time, goodbye. BankMed, the medical scheme of choice for the financial services industry. The Wellness Effect is proudly brought to you by BankMed, yours in good health.